Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Jo Alch. She's with Joy Care Management. Good morning.
Good morning. Thank you for having me.
Well, you have a lot of good information so that we're going to try to pull out of you today for our listeners. And what we're going to talk about today is, should you hire a nurse to help you navigate the senior care industry? Because a lot of people find themselves, their loved one starts to decline, things like that. They don't know what to do. They don't know where to turn, making good decisions, getting the right help, all those things. And so why do you think it's so difficult for families to actually navigate the senior care industry?
I think it's difficult because people do not make plans. And I have such an example. My father-in-law went to West Point, taught at West Point, did 2 Vietnam tours, but he refused to do any kind of will, advance directive. He was so stoic. He refused to prepare for the future. And he is one that died in an ER. They broke his ribs. He had no DNR. And for some people, it's just a topic they do not want to talk about. And it's so important that we talk about our future. I mean, we are all going to die. We all pay taxes. We're all going to die. We know that. And, I have done some research, and only 3% of Americans have long-term care insurance. Just crazy. 22% of Americans have no savings for the future. No savings. And it's just, nobody wants to talk about getting old, and even, my elderly clients that have to move to a memory unit or a assisted living will say, everybody here is old. Nobody wants to talk about getting old. And, these are our golden years. We save for the golden years, but the golden years may not be golden. So we got to prepare for plan B too. So.
Well, I don't think that, it seemed like, my birthdays say I'm older, but I don't feel older.
I know. Me too. I'm 62 and I'm like, wait, what happened?
And I was thinking, at this age, you think as a kid, you're thinking, oh my God, even my grandkids think, oh, you're old. I'm like, no, I'm not.
I know. We're so much wiser.
So let's talk about, the things that kind of get in the way, so like emotions and, that prevent people, because a lot of times people they're in shock, they're in, they're, just anxiety of, oh my God, now we have to do something, and so how does that affect being able to make good decisions?
Well, what I find with care management for Joy Care, and I can speak for other care managers too, people call when there's a crisis, or the adult children live out of town and they don't have time. They don't have time to deal with issues. Mom's in the hospital. So yes, emotions do get in the way. When somebody is sick, has had a stroke, heart attack, you're panicked, and it is hard to make tough decisions. You hear what the doctor has to say. The doctor may have 15 minutes with you. The hospital case manager may have 10 minutes with you. And so how do you make these important decisions and make choices when you're sleep deprived, stressed, worried about finances, worried about mom, worried about dad at home, or they've got a dog at home that somebody's got to take care of. There's so many obstacles, and it's just, for any of us, it's hard to make decisions rationally when we're stressed.
I can appreciate that. And so most definitely. And so how can having a nurse on your care team help with the process?
It's funny, as So I'm a member of Aging Life Care Association. I'm an ALCA member, and it used to be called the Geriatric Care Managers Association, but so many people call themselves, financial advisor, estate planner, navigator, senior navigator, but we are credentialed as aging life care members. So we are helping that aged person have the very best health care as they decline. Having a nurse involved, so many care managers that are social workers are missing that piece. There could be something so simple that a nurse brain can look at the big picture and fix it just by maybe their meds that are contraindicated. I want to give an example. I have a patient that very high functioning, had Parkinson's for 14 years. And all of a sudden she was hallucinating. She was seeing things, and it was so debilitating. It was so crippling. She was afraid people were coming out of her chimney, coming out of her microwave. And I had been asking her to let me handle her medication. And she was like, I can do that. Jo, I'm not an invalid. I want to be able to do my own meds. Well, I said, just let me take a peek. Well, what she had done, a specialist prescribed the same medicine she was taking that her neurologist described, but they were two different names. So she was doubling up on carbidopa, levodopa. And the number one symptom of taking too much is hallucinations. And no one knew. Primary doctor A did not know specialist had prescribed two different things. One was generic. And so she was doubling up on her medication. And it was just a simple look at her pill box, look at her medicine, and we were able to resolve. We didn't have to send her to a geri-psych hospital. We didn't have to take her to 3 different specialists. We were able to fix it. So just having that medical mindset. I have so many families that I work with where the doctors now, internal medicine doctors will look at 3 problems. If there's anything else, they're going to send you to specialist A for cardiology, specialist B for renal. And Dr. A doesn't have time to talk to Dr. B, and so it's so important that everybody knows what the other person is doing. And having a nurse as that communicator to make sure Dr. A knows what Dr. B has done can make the most, just makes a lot of sense and makes things easier, not only for the healthcare professionals, but for the patient and the family. So it's a win-win to have a nurse involved.
We tell clients all the time, and I learned this the hard way. Your doctor's going to prescribe medication, but they have no idea how it's going to affect you. And, so you tell them if you've got multiple medications, you need to sit down with the pharmacist and go through all those. You need to make sure that one's not messing up the other one, because if you've got multiple doctors, you're right, they don't talk to each other. Mm-hmm. My grandfather had one doctor and he messed that up, because he prescribed something that he didn't read the literature, because once I read it after he was crazy for 2 days, was a prescription they never should have prescribed him. And so I could appreciate, having someone, sometimes it's just a matter of being able to talk the talk, because clients are like, I don't understand what they're talking all these, medical terms. I don't understand, so do you find that really is helpful?
Oh, very helpful. And it's also helpful when a senior is going to a physician's appointment, take a nurse with you. It's funny, some of our hospitals here in Dallas are not real fans of our care managers, nurse navigators, because we're going to ask the questions. And I have a perfect example scenario. This patient was having back pain and went to his primary care doctor. The doctor sent him to a urologist and said, you know what? It might be your kidney. Well, come to find out, the patient had a benign tumor in his kidney. The patient was 86. And the kidney specialist wanted to do surgery. There was a 75% risk of this patient being on dialysis, but he said, oh, you really need this surgery. It wasn't even cancerous. We didn't even know how quickly the tumor was growing, so I went with the patient and I asked these hard questions. So what is the benefit? Oh, well, you take that, that tumor's going to be gone. But the tumor's benign. So how do we know, is it slow growing? Is it no growing? How do we know how long it's even been here? And don't you think the risks having to go to dialysis are going to outweigh the benefits? Well, threw his hands up in the air. You do what you got to do. So anyway, I was able to ask the questions. A lot of, I think their surgeons are great and they save lives. But there are a lot of surgeons out there that all they're thinking about is scheduling that next surgery. And that's what's on their agenda. They're practicing what they do. They're not looking at the big picture. So we can even on Zoom, if, I'm in Dallas, but I go everywhere. I helped a patient in Aspen, Colorado. This sweet little woman went for a family vacation and wound up having to go to the ER. And so I was her voice for the family, and they were so appreciative. So just having a nurse ask the questions, let us be on the phone. Thank goodness we have technology now. We can be right there in the doctor's office without having to go, So it's a huge benefit, Kim, huge.
Yeah. My sister does that to my mom. She makes her put her on speakerphone, appointment with her so she can ask her questions, make sure she hears everything the doctor says. Because my mother has what we call selective memory.
Right.
And so it makes a difference. So what advice would you give family members who are starting to recognize that their loved ones, may need some additional help?
I recommend hiring a nurse navigator or a care manager. And the reason being, our healthcare system is so confusing. It's even confusing for healthcare professionals. But if you can go to the hospital and you're recommended to go to a rehab, but the doctor, that hospital, has a investment in that rehab, or maybe he's the medical director of that rehab, or maybe he owns a home health that is the only home health that this hospital refers to. Maybe that's not the right home health. Maybe it's not the right rehab. Maybe this patient would do better just going home with home health and having physical therapy 2 days a week and finding a trainer on opposite days that works with seniors, but there's a bigger picture, and that's where we are experts, so my rate to go in, I'm just going to share what the average is. So I go in and do an initial assessment. It's $350. And then for every hour of care, maybe it's a doctor's appointment is 15 minutes. So when the doctor comes in the room, I'm ready to go, get me on the phone. And so I charge like 15-minute intervals. So yes, our initial assessment, we need to charge a little more because we need all the information. We need the med list. Who's the doctor? What are the goals? What are the wishes, that this patient wants? I have families that, maybe there's 6 kids involved and 3 want aggressive care, 3 want palliative care, but what does the patient want? And what I'll say is, if you could sit down and have a cup of coffee with Dad 10 years ago, what would he have said to you? He would have said, I don't want all this. Usually they're going to say, why are you putting me through all this stuff? So having an advocate, maybe 6 kids, but the daughter who's the medical power of attorney is being bullied by other siblings, and I don't mean, I just, coaxed by other siblings. Well, you know what? That's not right, So, and they're doing their best to be that advocate, but they're hearing, it's so important to have a neutral nurse to help. Now, do I make friends with every family member? No, but I'm telling them, what they need to hear. Maybe it's not what they want to hear, but we're telling them what they need to hear because it's what's best for that patient. And maybe what's best for mom is not what son or daughter wants, you know? So we're just like you're an advocate as an attorney, an elder law attorney, you know, we're advocates in that nursing realm. And we want to do what that patient wants. It's about the client's wishes. So.
I'm a firm believer that quality of life trumps everything.
Mhm.
And that's always what you should keep in mind when making decisions for, for clients, assuming they all want the same thing. So what advice would you give families who find themselves in the middle of a crisis?
In the middle of a crisis, call me anytime. And, you know, we can, you know, what I know, there are visiting physicians. Let's say a patient's in crisis at home, not in the hospital. Let's say they're just in crisis at home. Let's say they fell, the paramedics got him up, but, you know, dad has not made any plans. He fell. He doesn't want to go to the ER. Okay, you know what? We can get the ER to come to you. So there are ERs that basically go to the home. You pay a copay just like you would going to the ER. Instead of waiting 15 hours in a lobby full of sick people, you're waiting at home in your recliner watching the news or TV, waiting for that. If you need an X-ray, they can do that in the home. So, so first we find out, like, let's find out what's going on. What is going to be the easiest on your mom or dad or uncle or loved one? And then maybe the fall is there's nothing broken, but you know, you'd really benefit from some therapy. I think dad is just, you know, he's got a bed sore or he's sitting in one place. So, okay, let's get some home help out, paid for by Medicare. You know, dad is wandering at night and mom can't sleep. Okay, you know what? Let's get a caregiver at night for 8 hours at night so mom can sleep those hours. Let's look at those meds the patient's on, and maybe he needs something to help with anxiety at night. Oh, dad doesn't like to take medicine. Well, you know what? He doesn't like to take medicine, but maybe there's something that can help with what's called sundowners. You know, there are just so many things you can do without the trauma of having to put them through ER visits and hospital stays and rehab. I mean, I really see the future is the hospital is going to be at home. And in Dallas, there are 2 hospitals that have programs that you can be hospitalized at home as long as you have family support, which is really cool. It's really cool.
That sounds phenomenal.
I know. And that's through Texas Health resources. So I'm learning a little more about that, but I think that's amazing too. And the hospitals aren't going to advertise that because they want them to go to the hospital. The billing, they can charge more. But hey, you know, it's a wonderful solution to the risk of, you know, maybe wife works and she can't be at the hospital all day. So having the hospital at home or ER at home, you know, wife can still get her work done while we're waiting on the ER to show up. And the ER is, it's usually a nurse practitioner and an EMT, which is such a great model. And they're all popping up everywhere. So, that's what I'd recommend. And, you know, people can call me if they just like, Jo, I just have a question. You know, I can give you 10 or 15 minutes. I can't be your lifeline, you know, but if you just need, you know, Jo, who do you recommend in Charleston, South Carolina? Well, I will find an advocate for them in South Carolina that they could reach out to. So I'm just happy to help. I want to serve. You know, I have a very strong faith, and I feel, you know, as a nurse, that you know, and people are to care for our elders, and it's very sad. We are a selfish society, and there are fewer and fewer adult children. You know, people are living longer and having fewer kids, and people live out of town, and you know, we need to be the hands and feet. You know, and I'm real firm about that and feel just real heartfelt about that too.
Perfect. So, Jo, if somebody wants to contact you, how do they find you?
They find me. They can go to Joy Care Management. We have a website in progress right now. We're updating it back today, which is exciting. But you can call me on my cell phone. I always answer, or I will call you back. And you can text me 214-415-3779. We also are on Instagram, Joy Care Management too. So, and I've got a team of nurses. I've got 3 nurses and 2 more in training. So we've got a great team. It just works well. We do all the social work part too. We don't do financial. And we don't do legal. I'll leave it to the experts. But I do love working with elder law attorneys that are credentialed like you, and because don't just when you look on the internet, all these ads, they're always ads, and you want to click to the first one. But really ask a professional like Kim or me, who do you recommend for, my mom is just going to the hospital and she keeps going back and forth and we don't know what to do. And the doctor keeps sending her to the hospital. You know what? Get a nurse navigator, get a nurse advocate to come out, or at least do a Zoom call. And I can do that too from anywhere. So, we would love to be able to help and just answer those simple questions.
So perfect. Well, thanks so much, Jo, for being on the show today, and we look forward to seeing you again sometime soon.
Thank you again. It's been an honor. Best wishes to you. Have a great weekend.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.